So hello everyone, and today we'll be starting a new series, that is Osce series for the Egpgs, that is exam going postgraduate students. So let's start with case 1. So these are very high yield questions that can be very useful for the examinations, particularly the practical examinations for all the exam going PGs. So let's start with the first case of this Osce series. So here we have a 22-year-old male who presents with ataxia, dysarthria, altered sensations, and no history of fever. This is very important. There is no history of fever. So what exactly do you think is the diagnosis in this case? So here I have provided axial section of flare, T1 post contrast images of the brain, and T1 post contrast images of cervical spine. I'll give you some time to appreciate the findings and diagnose this particular case. So on these flare images, we can see that there is a signal change, hyperintense signal that is seen in the periphery of the pons. On the T1 post contrast images, we can see that there is patchy enhancement that is seen in pons and cerebellar peduncle as well. There is some patchy enhancement in the cervical cord as well. So this particular condition involves the pons, the cerebellar peduncle, as well as the cervical spine, and there is no history of fever, hence ruling out encephalitis, meningitis as diagnosis. So what else can it be, particularly involving the brainstem and the cervical cord and the cerebellar peduncle? So the diagnosis in this particular case is Klippers, that is chronic lymphocytic inflammation with pontine perivascular enhancement responsive to steroids. So the findings are characterized by multiple punctate patchy linear regions of contrast enhancement relatively confined to pons, which was very well seen on the T1 post contrast axial images of the brain. Similar changes can also be seen in cerebellar peduncles, hemispheres, as well as the cervical spinal cord, which was also seen in our case. Despite the striking post-contrast appearance, there is relatively little edema or positive mass effect, as we could see that there was no evident edema that was seen on the flare images. There is no vasculitic angiographic changes, that is, there was no blooming on GRI or SWI sequence as well. So the differentials for this case include tumors or proliferative conditions like CNS lymphoma, brainstem glioma, but these conditions will show particular mass effect with post-contrast enhancement. Infective conditions can actually mimic this, but in infective cases, there will be history of fever and clinical history will suggest the diagnosis, and the treatment is completely different. Here in Klippers, the treatment is steroids, while in case of infective etiology, the treatment line will be completely different. It can be paraneoplastic or inflammatory as well, like CNS vasculitis, but in this case, there was no blooming on GRE sequence. It can be demyelinating disorders like multiple sclerosis, NMOSD, and MOGAD. But in such cases, there'll be other findings which will also be present, like Dawson's fingers along the perivascular area.